Homelessness, a Social Work Speaks presentation by Kathleen Alley. Now, many people, and maybe you're one of them, see homelessness as a moral failing. People think that the US is the country where anyone's dream can come true if they work hard enough. But when you really start analyzing it, and even scholars agree with this, the ongoing struggle of homelessness is not a moral failing. It's actually the result of a pretty long series of massive policy failures. But in order to learn from our failures, we have to know what they were. We have to study them. So today we are going to discuss the history of homelessness in the United States, issues that affect homelessness, the history of U.S. policy efforts to address homelessness, and what steps can we take today to end homelessness as we know it. Let's start with the history. So in the 1900s, policy was focused on really homeless men, dependent children, families with children, people who were classified as transients were helped by bus therapy, which was just a bus ticket to another city because if they're out of sight, they're out of mind. Other assistance at that time included settlement houses and groups who thought that they only wanted to help worthy poor people and would categorize who is worthy of our help and who is not, which is pretty awful, and in complete violation of our code of ethics, right? Which is that every person is deserving of life. So in the 1920s, when the Great Depression struck the country, many families lost everything and became newly poor. This influx of people living under the poverty level was a national crisis. So the government responded really well. Food distributions through soup kitchens, other systemic efforts were really successful at helping the people who needed it the most. Then in the 1950s, policies shifted to let's construct more houses, let's increase loan programs. This will solve the problem. It wasn't until the 1970s that the war on poverty as we really know it began to take shape, because the focus became increasing low-income housing, increasing support for people that were living under the poverty line. In the 1980s, organizations began to fund healthcare for the homeless. The media increased coverage on the homeless crisis. Advocacy groups began to form focused on housing. Faith-based organizations continued to provide food and other services, and community-based action groups grew. Then in 1987, the Stuart B. McKinney Homeless Assistance Act was passed. And in addition to emergency shelter, provided structure for providing transitional housing, outreach, and even case management. Then in 1994, the first federal plan to break homelessness was published, called Priority Home. It was passed into federal law by the U.S. Department of Housing and Urban Development, or more commonly known HUD. It called for two categories of homelessness labeled crisis poverty and chronic disability. In 1996, President Clinton signed the Personal Responsibility and Work Opportunity Reconciliation Act, which means that TANF was formed, or Temporary Assistance for Needy Families, which has been a largely successful program, even though funding has drastically cut since it started. And now we can start delving into these issues. So in 2002, estimates indicated that roughly 800,000 people were without shelter nightly in the United States. And a little over 20 years later, that number remains relevant. Point count estimates show homeless numbers in the 600,000 steadily since the year 2007, Now, to blame homelessness on any one issue is narrow-minded. Every unhoused person has a different history, different barriers, different strengths. But in studies on root causes likely to result in homelessness, certain populations have been shown to be more likely to experience homelessness in their lifetimes. In order to address homelessness, the primary issue is to seek to understand the people most likely to struggle with it so that we can identify solutions. So, vulnerable populations who are more likely to struggle with homelessness include people with psychiatric disorders, if they lack social networks, healthcare, other program supports, they can't live independently in the community in a successful way. Individuals with physical disabilities, their mobility limitations just make services inaccessible. Women and children who are victims of domestic violence after fleeing abusive domiciles really struggle with this. Asthmatic children in shelters who are not receiving adequate medical attention. Individuals currently employed, either full or part-time, with too little income to afford adequate housing, right? Or even food. So another vulnerable population is single mothers. They're unable to work because of childcare responsibilities, or they lack the skills that they need to meet the demands of a rapidly changing economy. Can they find a job that will provide for the needs of their family? Runaway youths are likely without access to adequate services, right? So rural families who've been forced to abandon family farms or small towns due to economic crises in regional, national, and even global markets. Men, many of whom are veterans, who have only the life on the street for economic and social supports, are especially vulnerable. And that brings us to people with chemical dependencies who are unable to maintain a stable residence, and refugees, asylum seekers, migrants who have no place to turn to. Individuals and families are excluded because of their criminal history. And of course, those displaced by disasters, whether that's natural, handmade, or both. So over the last 30 years, efforts to end homelessness have not been successful. Reasons for the continued issues of homelessness include systemic issues that fail to give people experiencing poverty the resources they need to prevent homelessness in the first place. Lack of access to affordable housing has been an ongoing concern. This means economic resources are insufficient to meet even a family's basic needs. In 1970, there were 6.5 million low-cost housing options for 6.2 million renters. We had enough housing. But by 1995, there were only 6.1 million units and over 10.5 million renters. We just don't have enough housing. We have to see a drastic reshaping of policies surrounding addressing homelessness, starting with, in my opinion, abolishing this recent trend towards criminalizing homelessness. Homelessness and poverty are critical policy issues. They will be for the next century. Until harmful policies are overturned, the harm they have done will only continue. Research continually identifies lack of affordable housing and extreme poverty as some of the roots of homelessness, but policies have really just focused on individual need without even addressing those systemic causes. And these harmful policies have really had consequences. We've got a reduction in public assistance, failure to provide universal health care. We have a lack of affordable housing, a lack of employment opportunities for people, a lack of affordable education to get the education they need to get an employment opportunity, and even a lack of affordable, nutritious food, and of course, always racial bias. When we think of the issues and background of homelessness we've just talked about, we can go even one step further. We can pinpoint at which moments harm occurred and even which past attempts had some great effects. we can learn from our failures and our successes. So the wide scope of emergency response during the Depression era was a strength. Long-term structural changes have proven to increase well-being. Programs like Medicare, TANF, other services to elderly citizens. Now, failures are just not increasing system-wide changes in the 80s and 90s and focusing on punitive measures like criminalizing homelessness, anti-homeless architecture. They only make the issue worse. So, what are the solutions? NASW has put together a really great list advocating for the following policy solutions that will really provide long-term solutions to this problem of homelessness. Number one, we need affordable and adequate homes. We need suitable living environments for everyone in the United States. Number two, social workers have to be actively involved side by side with people who are homeless. Social workers need to be networking, creating advocacy groups, identifying problems and then solutions, and encouraging communities to build continuums of care that integrate housing, income maintenance, supportive services, make it easier for people to access all of that. Number three, housing subsidies should be available as an entitlement for all households with emphasis on McKinney-Vento homeless programs, housing opportunities for persons with AIDS, Section 811, programs for the education for homeless children and youth. Number four, the complexity of housing assistance programs has to be organized into a more efficient and coordinated system that targets very poor people and households at highest risk of homelessness. Five, efforts to encourage state and local communities to use mainstream programs to build those continuums of care. Like I said, let's integrate housing, income maintenance, and supportive services. Six, education, job training, related supportive services have to be expanded. They have to be elements that prevent homelessness. Studies show 11% of people who are homeless receive SSI benefits, but almost 40% experience mental health problems, and 46% have a chronic health condition. So why do more people not have SSI? Seven, homeless children need to be identified as a special population. They require better nutrition, access to clothing and hygiene, continuous appropriate education, a space to study. Services have to be provided. 8, treatment and supportive services for special populations should be expanded and be focused on innovative approaches. Number 9, federal, state, and local proposals to cut expenses to restructure social welfare programs should be studied. How are those cuts going to impact homelessness and the services that people need? 10, the lack of bipartisan effort and buy-in on policy goals to end homelessness still continues. It's a major stumbling block to agenda setting, to getting any kind of policy change. So political action strategies are needed. We've got to get people together on this issue. 11, support for a living wage to help prevent homelessness has to be widespread. Now, if a social worker truly lives by the NASW Code of Ethics, if their purpose is to enrich the well-being of all and follow an empowerment perspective, they have to join the fight to end homelessness. State and local communities, nonprofits, public agencies should replace shelter care with a larger continuum of services for at-risk populations. Excessive rent has to be ended. Fair market rent should be implemented across the board. Resources centralized. And mainly, misconceptions have to end. Homelessness is not a moral failing. It is a failure of our system and our policies.